Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about how to ask for what you want as a medical coder. Now, if you're brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know, all of my experiences and the tips and the tricks to this field with all of you. So I hope you'll take a second, hit that subscribe button, hit the like button at the end. If this video helps you, I hope that you will share it. Okay, so let's get started. All right, so what do I mean when I say this? How to ask for what you want as a medical coder. This video applies to medical coding students as well. Here's the thing. When I've been getting some questions lately from people, and they always start out with an apology, right? They say, I'm sorry, can I request a video about this? Or I'm sorry, I don't understand this part. Okay, so when you're asking questions, this is the number one thing I'm going to tell y'all to stop doing. Is to stop apologizing, because of the simple fact that you have nothing to be sorry for. And even if you feel like, oh, it's just to be polite, that's not being polite. You know, our words have meaning and they have purpose. And when we misuse words like apologizing before a question that you're trying to learn something, it's not going to make what you want very clear. Okay. And with that being said, this business, medical coding, the medical coding field, is filled with alpha personalities. I will say this. They are filled with alpha personalities. These providers, alpha personalities. And the coding staff, again, alpha personalities. You have your supervisor, and then you have a lead, and then you have your coworkers, each with different levels of experience and some with different credentials from you. So because of this, and everybody's experience as a medical coder is different. So a lot of times, you know, coders are very, you know, independent, and they think independently, and we hate to be told that we're wrong. But when a really good coder will know that there's going to be times that they are wrong. Even I admit there are times when I have been wrong. But I learn from my mistakes, and I don't say, well, I don't want to accept this error because you were the one who told me about this error. That's ridiculous. I've seen people do that. And a lot of times when your coworkers are trying to help you, sometimes you get lucky and you can get a coworker that will try to help you. And if you shy away from that and, oh, I got it, you know, I don't need your help. No, again, that's wrong. We have to work together as a team. That is part of what we do. And you have to develop a thicker skin, because sometimes people like medical coders, medical coding students, they want to do things all on their own, but then they don't want to take advice from people that are really just trying to help them and to better understand something. Okay, so that's the first part. Now, when you are going and talking to providers, right, and whether it is by email or face-to-face, and you start out by saying, I'm sorry, this, or I don't mean to bother you, this. It's very frustrating, okay? It's frustrating because of the simple fact that, why are you apologizing, number one, okay? You're there for business. You're there to help them. The reason that you are trying to clarify what you know is because you've already done your research, which I always tell you guys, do not go to these providers until you have done your research first. You have to go and look for reputable resources. And I have many videos out where I have references for coders, viable references that are actually valid that we can use. And you have to be careful about where you're getting information from, because if you're getting it off a blog, right, and somebody says this, well, we do it at our facility this way, it's not, you never know how that information is being interpreted, and it's not always correct. I've seen some of these blogs, and I've seen that they've been wrong, and I'm like, that's not even right, you know. But, you know, these are closed. I can't respond to them. So it's just like, wow, that was really wrong. So you hope that they did their research later on to find out that the actual answer. But guys, when you're asking, you can't be intimidated by the fact that you don't know. And a lot of people say, well, I hate not knowing. Think about this. We as medical coders have to know what doctors know while never having gone to medical school. And I say this a lot because it's true. We have to understand the disease process. We have to understand the body. We have to understand the procedures. We have to understand what goes on with these procedures to really fully comprehend what we're reading. Because it's not enough to be able to just read the documentation and say, oh yeah, they did this, okay? Because I've seen coders who will go through surgery notes and look at the title of the surgery and then just code from the title of the surgery without actually taking the time to read the surgical note. A lot of times complications can occur. Different procedures are actually performed versus what is the title of that procedure. So what is being coded needs to reflect what is being documented. If a provider doesn't understand what procedure name it is and they select something because that's familiar to them, right? And then they go on and they document something completely different, which I've seen them do, and the coder doesn't take the time to look, then there's a problem because the patient has to pay something that they shouldn't have even had to pay in the first place. The facility can potentially lose money when the insurance company comes and does an audit and says, oh no, we gave you too much money because this wasn't the procedure that you did. So this is why I say you guys have to look at all the details, and you have to, when you ask questions, don't apologize for asking questions, because this should show, right, that you are trying to learn. It's going to be a lifetime process, guys, of learning, honestly. And you have to, like I said, develop that thicker skin, because when you get offended easily, or when you get your feelings hurt because maybe somebody is frustrated because they like, maybe they raise their voice or whatever. Sometimes providers will do that and they don't mean to, okay? Now, I've had some get snappy with me, and it's fine. I mean, I'll take it all day long, you know, because I can take it. I mean, to me, when I see them and they get a little frustrated and they're like, Blue, this is stupid. You know how many times I've heard that? This is stupid. I don't have to do this. Okay. Then we have to go through this process of learning and listening to each other. It's all about learning. And when you are a medical coder, it's a partnership. And it's a partnership where you have to be equally as strong as this alpha personality that you have to deal with. Okay? And the same goes for dealing with other medical coders, because you may be a brand new medical coder and you may have to stand up for yourself in an audit, right? With a veteran medical coder who's been around for years, who's got an impressive array of credentials after their name. And you may have to tell them, well, actually, the answer is this because of this. And then you have to be able to show how you got to that, because not all auditors are correct either. Okay, so sometimes your whoever's auditing you, right, may not see what you have seen at that moment. So if you show them, and then you show them your resources, and you show them how you got the answer, and you are correct, then that hopefully that supervisor or that auditor will be like, oh, okay, well, they proved their point. But it takes you not to be intimidated by the things that you're learning, and you have to be able to share these things. So please stop apologizing. You can't apologize, and grow that thicker skin, because know that there's going to be people they're going to sound harsh to you, but they don't mean to sound harsh. That is just something that just comes out. And it's the way that people communicate, in the fact that sometimes they are so smart that they want to just hurry up and get it out. And they don't stop and take time to think about, how does this sound, right? And that's not always right, but we're human, right? So if you understand that and you can accept that and not take it personally, then you're already on the road to doing very well, okay? And I don't want you guys to do well. And so sometimes, like I said, there's been times when I've said things and I know that it offends some people. But again, and I always say before, this isn't meant to offend anybody, because the thing is, what I'm saying is the point. Get to the point. That is my whole deal, is you have to get to the point. And so a lot of times I won't sugarcoat things. I will say it directly. And so a lot of times I'll hear, well, Blue, you're being very direct. Well, I understand. But why would you want to sugarcoat it any other way? Because to me, I just want to get to the meat of the potato. Get to the point. Because to me, there's a lot of other things to be doing and learning, rather than just taking our time to just sort of look around and just like, oh, not really getting to the point and beating around the bush. I did have a viewer a few days ago that said, well, I need help. Okay, well, what do you need help with? Everything. Okay, well, what does everything mean? That's the point. What does everything mean? There's a lot, right, to being a medical coder. There's knowing your E&Ms, knowing your diagnosis coding, knowing your procedure coding, knowing what it is all about, everything that you're reading. So with all of this in mind, what is the issue? What is it specifically? Because there is so much to it that it's like, okay, how can I help you? I will help you, but tell me what it is. And that's the thing. And especially when you get in front of your providers, whether, like I said, whether it's by email or face to face, you have to be able to get to the point. And of course, be polite, but get to the seriousness of it all. And when you say, well, I have a question, I see this, I have researched this, and I understand this, but this does not make sense. Can you please explain? Then they'll know where to get to the point. And it's very easy. Once you learn to start communicating that way, where you're getting to the point right away, the better off it is. Because a lot of times providers will lose patience too as well. If they feel like, I've seen it, when a provider feels like the coder doesn't know what they're talking about or what they're doing, they lose interest quickly and move on to the next person. So if you are in a clinic and you're having this issue, then you need to work on your communication skills. This is a lifelong process as well. I have tried and learned many new things because on this journey, because of this, right? Because I want to make sure that my providers can trust me. Because when you can communicate with them well and they can trust you, that's when everything starts to work out well. The documentation comes out better. There's more detail. It's easier to get through because it's more understandable. Because as I've said, providers don't always know what specifically they know what they're doing, right? And so they document that, but there's not enough detail sometimes. And for us as coders, we know what the detail that we're looking for. So if you if you have the situation, then you need to make sure that you're talking with your provider and building that relationship, because that's when clinical documentation improvement comes into play, that further detail. And a lot of times they're like, well, I don't want to do no more detail and I don't want to do this. And they may snap at you and they may blow up at you and just be like, I'm not doing it. It's stupid. You have to just sort of care for them through that part, because that part is just going to be them and their personality. Now, of course, don't tolerate any disrespect. There's no need for name calling or anything like that. But when you see that they're just frustrated, don't take it personally like it's you, okay? Same thing for if your coworkers, get upset too. I've had many coworkers get upset because they know that I have a strong grasp of injury coding, and they get very frustrated because they don't understand. And so when I try to explain it to them further, they're like, I don't care, Blue. I give up. Oh, okay. Well, I'm trying to help you, but that's okay. If that's not what you want, if you don't want to, if you don't want me to explain it, that's fine. And then sometimes they'll come back and they'll say, well, I'm sorry, I was frustrated. Can you explain this? Then I know that I don't take that personally. It's not personal. It's whatever's going on in their own situation. But to me, I'm always going to push to learn more. And I'm always going to push to get a thicker skin. Because was I sensitive before? Oh, heck yes. It was hard when I had people yell at me. They're like, well, this is stupid. I don't understand. And I'm thinking, gosh, they really think that low of my profession and what I do. And, I always took it personally until I went through the Arbinger Institute training. And that really did help me. And so if you have to take these additional courses and things like that to help you communicate better, then that's something that you need to do. I've also been working on trying to speak more clearly, obviously, and just trying to get more where I'm not using so many words to get to the point, and so I've gotten better with that myself. I'm still a work in progress, but that's okay. I'm making the effort, and when people notice when you make an effort, that makes all the difference as well. And people are more willing to work with you. So that's something that I want you all to keep in mind. Make sure that you do your research before you go and ask questions. And when you're asking a question, do not apologize. You're there to help them. You're there to better understand. And when you ask me for a request for something, ask directly the question. Don't apologize because, again, what are you sorry for? You're sorry because you're trying to learn more? No. You just have to not be intimidated and just be more direct when you're asking questions, okay? Because it's better for everybody. At least this way, we can just cut out all of this other stuff and just get to the point. Because at the end of the day, that's really what is going to save you and make things a lot easier for you. So I want you guys to think about that. Continue to do your research when it comes to knowing places to find answers, right? And also, also make sure that when you are finding these good resources, that you keep them like on a list or something. That way you know where to go, okay? And always look through the book first, because your first resource is going to be the book, whether it's the coding manuals or the procedure manuals. This way, it will help you. So I hope this was helpful today. I hope you guys know that I come from a place of respect and care, okay? And that the reason that I tell you these things is because I wish somebody would have told me this stuff in the very beginning, okay? So I'm going to wrap it up, but I hope y'all had a great Monday, and I will see y'all again tomorrow for Q&A Tuesday. I hope you'll take a second, and next month, of course, it's going to be July, so I'm still working on some ideas for Christmas in July. So anyway, if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!